Care Partners of Nebraska. We are excited to have Bede Bolin, an instructor with the university's Gerontology program, with us today. And Andrew and I are just have the privilege of knowing Bede for a long time now, being involved with the classes, and wanted to talk a little bit about his personal journey and how his family is realizing the impact of the coronavirus, and also some things he's seen trending in the gerontology field and healthcare in general. Bede, thanks so much for being here today. Would you share a little bit about how your family is realizing the impact that the coronavirus has had for you and your mom?
Yeah, sure. My mother is I would say for a skilled nursing community resident, she's typical of what we see across the country. She's 86 years old now, white, woman, widowed, which kind of falls into the general category of who we are seeing in the skilled nursing communities. And she has a couple of issues that she has. She has what is called frontal temporal disorder. And currently right now, the disease has progressed to the point where she cannot speak. She has what they call chorioathetosis, which is very similar to what we see in individuals with Parkinson's disease. Okay. But she can't move. She can't walk. She can't move. She can't do anything for herself. She can't feed herself. She can't toilet herself. She can't dress. She can't get out of bed. We're using the easy lift now to get her out of her chair, just to take her to the restroom, to take her to the shower or to the bathroom, etc. So you could tell that she's got significant issues. And so, but the impact that's currently with our family with the coronavirus is that she's in a skilled nursing community, and I'm not allowed to see her. None of the family can see her. And she's totally isolated in her room because in the skilled nursing communities, at least the one that she's in now, they do not go out to the congregate area to eat their congregate meals together. So each one of the residents are eating their meals in their own room, and she has to be fed. So her food is brought to her. And then one of the direct care workers have to feed her. And if there's any activities that are going on in the community, what they do is they put my mother and the other residents, if they need to be in a wheelchair, and they set them in the doorway, and then they try to conduct the activities in the hallways with multiple direct care workers, managing the activities. Like, for example, bingo. That's a big favorite one. My mom really liked that. So she'll have her bingo card on her lap, and then they'll have someone in one of the corners of the hallway so they can holler down both hallways and, call out the numbers, and so they can, play bingo. And they've tried to do that with other types of activities. So there's a couple of issues there. She's totally isolated. She's isolated from me and my wife and her grandsons and her great-grandchildren here that live in Lincoln, and of course the other siblings. And she's isolated within the community because she can't even leave her room. And so in my view, she's doubly isolated. She's isolated to her room, and she's isolated from her family right now. And so, and that has two different impacts. That has an impact on her. I can tell that upsets her. And of course, there's an impact on me and my wife and my son and his wife and my grandsons, and of course my other siblings, where we're not allowed to visit her. And so, I miss seeing her. I have the opportunity. I visit her literally every single day, unless I'm out of town. And so, for the last since March 13th, I have not been able to see her at all. So that's well over a month. And so I've never gone, unless I was traveling overseas, I've never gone that long without seeing my mother. And so, and that kind of, that has an impact on me. As well as a informal caregiver, taking, doing things for her. I wash her clothes for her. She doesn't allow the community to wash her because they don't do a good enough job. So I wash her clothes for her, make sure they're nice, folded and neat, and bring her chocolate malts and her coffee and donuts. And, none of those kind of things are happening anymore. And so the the only time I do get to see her is I have one day a week on Thursdays at 4 o'clock in the afternoon. The life enrichment coordinator, she has an iPad, and so my wife has an iPad, and so I get to do a FaceTime call with her, and so I get to see her Thursday afternoons at 4 o'clock, and we have a FaceTime call. Now, my mother can't speak, so it's a one-way conversation. I can see her, I can ask her questions, and she can give me a yes or a no. It takes a little while to figure that out, but that's all the time. That's the only opportunity that I have to actually visit with her. And now I do have one sister in Colorado who actually is doing a FaceTime call once a week, every Monday at 9 o'clock in the morning. So she gets to see my sister and then myself. My other siblings have not set that up, and I'm not sure why they haven't. But I have 4 other siblings that have not. But they've been sending lots of cards, she's got lots of flowers in her room. Because, by the way, I did sneak by this past weekend. I walked over there and looked at her in the window and saw her and waved at her, because I originally was going by every day and looking at her in the window, but I got a letter from the director that told me that they did not want me to do that anymore, to visit her through the window. But last weekend I finally went over there and actually looked in the window, because she actually asked for some clothes, some short sleeve clothes, some summer clothes, because it's getting nice outside. Mm-hmm. She actually had an opportunity. They took every resident individually outside for like 20 minutes the other day when it was really nice. And so while my mother was out there, she realized that she had only winter clothes. So I was allowed to bring her some summer clothes that before they put them in a closet, they were going to wash them and everything there, and then hung them up and put them back in her closet. So I took advantage again to look at her in the window and holler. But I saw what the point of that story is that there was flowers all over her room. She had cards, letters on her table, because all my siblings, I told them, and told all my siblings to send, cards and letters, and they've been sending some food items as well. Because my mother has 26 grandchildren and 31 great-grandchildren. So she has quite a few folks that are writing her. So that's one way that we've been able to try to keep contact with her in that isolated, in her isolation there. So
I love that they are able to help you. I think that Bede, when audience members watch this, they're going to really relate to you. There's a lot of adult children that right now are not in the position that they can see their parent or care for their parent. And so they're really relying on other additional teams, and, whether that be the CNAs that are there, or the med aid, or the person that, opens the mail and maybe reads it for her, or the activities individual who's holding that phone so that you can FaceTime. But, when we think about the healthcare workers and what they're doing right now, and even the term essential, even just that term essential, as I'm hearing you tell your story, it just gives me goosebumps knowing, as far as just how important that role is that they're providing for you as a family member who's not able to bring the milkshake every day that you normally would bring, right. And knowing what they're doing there and caring for your mom during this time. Anything else you'd want to add to that as far as how important those people are to you right now?
Absolutely. And I just got a phone call the other day from Linda, one of the nurses, because, at a skilled nursing, you got to have a nurse on each shift along with the other direct care workers, the CNAs, the med aides, et cetera. And so, and I've had conversations with them, but I tell them that I really appreciate what they're doing, because I know their life is pretty tough as well. They got certain protocols that they have to go through every time they come to work, temperature taking, they got to gown up, they got to put their mask on. And I think they realize that their life is a little more difficult as well, is that they have to go to each individual in their room to feed them, to bring food to them. And so their life has changed on how they're taking care of the older adults within that community as well. And so, you know, like taking them out individually outside. Well, before you could take all of them out, or whoever wanted to go, all in one big group and have one worker out there. Well, now you take one out at a time, and then you bring that person in, take another. So, I mean, that's a lot of stuff that's going on for those workers. So their life is tougher as well. And so, so I can really appreciate that. And I tell them that I really appreciate what they're doing for my mother and for the other residents that are there as well. And there's some other things that we talked about. Go ahead.
I think one thing that we're seeing is, you know, when we're doing home care, one-on-one in the home, there's some similarities to when someone's helping to care for someone within a community. It's definitely a lot more difficult in a community setting right now. But when you're talking about your family is a partner in providing that emotional support to your mom, but that has changed. I know that really weighs heavy on the hearts of everybody that's caring for seniors. You know, they're taking care of your mom the best that they can. It's challenging times, especially a senior that'll have cognitive or communication challenges. They don't fully understand, you know, why they may not be able to see their kids, why they can't go outside, why are people wearing masks? Very scary. So
yes, indeed.
A lot of respect for everybody that's pitching in and doing everything that we can in those days. They're tough.
Yeah, absolutely. I can't tell you how much I appreciate what they're doing for my mother right now. I know it's you know, it's tough on them. They have their own families that they're going home after they're off of their shift, and you know, and so they got to care for them as well. And I know they have issues with, you know, this whole pandemic going on, and their concerns that they have with their own family and working with these older adults in these kind of communities. And so, yeah, that's the piece that I don't have to deal with, you know. So. I really do appreciate what they're doing. It's a hard job anyway, and I think a lot of people don't realize that being a direct care worker, whether it's in-home health care or it's in a skilled nursing or assisted living, it is hard work. And when you're looking at a person like my mother, I mean, there's a lot of physical stuff that has to be done to help my mother. Now they have things, they have the easy lift, they have certain pieces of equipment that help them, my mother, get up off the chair and put her in bed, but still there's a lot of physical work, and I know there's some emotional issues, and there can be psychological issues as well with those workers, and a lot of times it's hard to see people that are in these types of conditions and as watching them deteriorate, particularly in a skilled nursing community. I mean, my mom has been there for 2 years. My mother's going to die there. I mean, that is her ending place for life. She's not going anyplace else. Yeah. And so, and I know that the direct care workers see her deteriorating as well, as much as I do. And so they're human beings. So, you know, that's going to affect them to a certain extent, maybe not quite as much as me, who I have a personal relationship, but that as a human being to another human being, that's hard as well. So again, I admire them. I really do. And they don't get paid a whole heck of a lot of money. And I think now what we're seeing is that hopefully, because of this pandemic, we'll see certain things will change as far as looking at those direct care workers and see how, quote, essential and meaningful they are in caring for our loved ones when we're not there, and how important they are and what they do. And of course, we have shortage of those direct care workers throughout the country. And so, yeah, so they're important folks, very, very important people.
Yeah, I imagine you've taught so many students. I don't know if you could even come up with the number of how many students have been in your classes, but as you think about their career paths and how important that field experience is and what they're doing right now, whether that be working in a healthcare facility, whether that be working through a home healthcare agency, or providing care to somebody, but could you talk a little bit about what your students see when they have that contact, when they have those contact hours, that field experience, and then they continue their healthcare journey?
Sure. Most of my students that are in my classes are pre-health students. They're pre-health in some way, shape, or form. When I say pre-health, I mean like pre-medical, pre-med, pre-nursing, pre-physician's assistant, pre-occupational therapy, physical therapy, ophthalmologist, some sort of healthcare field. And so a lot of them are taking the courses are involved in gerontology because I think a lot of them understand what that relationship is, that professional relationship that they're going to have with the older adult community when they get out in their healthcare profession. Mm-hmm. Understanding that probably the majority of their patients or residents or wherever they're working are going to be those individuals that are 65 years or older. And so they've gained an appreciation, or they have an understanding how important that is. And so particularly the students that are in my certificate program that are in the practicums out there actually working in the field, working with the older adults, they gain a significant appreciation with who those residents are, who those older adults are, and the impact that they have on the student themselves, and that contact time that they're getting where they can see some of the healthcare issues that these older folks are going through. And of course, then they also have an impact on those older adults, because what I've seen also is that intergenerational relationship is very important as well. Mm. And that a lot of them really care that these young people are interested in helping them and taking care of them. And it's very interesting that some of the, like, for example, just the other day, yesterday, as a matter of fact, I had one of my students that she missed her quiz on her, the quiz, and she emailed me to apologize and, that she missed the quiz, but that the reason she missed it is that she forgot that she had it, because she set up her training session at Tabitha was from 6 o'clock yesterday morning till noon, because she has volunteered, or she's actually now got a job, a paid position, because they need these healthcare workers in this current situation, and that she's decided to go out and get a job with them. And so she was going through her training. So I see a lot of my students are now volunteering because they're asking for volunteers because they need assistance. And some of them are actually getting hired because they already have their CNA license or their Med-Aid license. And so they're actually working in the field. So I'm actually really proud of my students. There are several of them that fall into that category that are also, they are currently taking all their courses now online because we're not in the university, but they also are working in an assisted living or skilled nursing community, or some of them are working in in-home health care, and they're going to work. And so they're taking some risks as well while they're going to school and now doing all their classes online. So that tells me a lot about the interest and the concern that a lot of these young people have as far as the older adult population. And I think one of the things that I emphasize is that, particularly with the baby boomers, the increase in the older adult population that we have in our country. There are 78 million baby boomers, which is the largest cohort we've had. And so there's a lot of work to be done for those older adults. Even if you take only 10% of older adults, 65 and older, ever going to end up in, a skilled nursing, assisted living, memory care. If you got 78 million people, that's 10% is 7.8 million people that are going to need in-home health care, medical, non-medical, living in some sort of community, needing some sort of assistance. That's a lot of folks. And we're already short in a lot of those healthcare fields, from doctors to nurses to direct care workers. I mean, we're short in the medical field, nurses, and so we have this shortage of healthcare personnel, but we have this increase in the aging population. And so we're going to get to a point where it's going to hit critical mass, where people like us, myself, the informal caregiver is going to have a greater responsibility unless we can fix the situation with the the direct care workers or the formal caregivers. And informal caregivers are going to have to really start stepping up to the plate.
Yeah, Bede, I would say that we've definitely seen that within our team. We have a lot of students, and as soon as they were able to move some of those classes online, dedicated themselves to the work that we do. They said, we want to take care of the clients that we serve, and we'll put on the extra
Excellent.
hours and work my coursework around that. And so I'm very thankful for the work that you do. It's great to work together with some of your students. They get introduced to things in career paths that they maybe weren't thinking about prior to taking courses with you. And it's also really neat to see how many people take those courses that aren't in healthcare, but they know that they're going to be working with the senior population. And so they're going to just have really great outcomes in learning great skills with that. So thanks, Bede, for your time. We really appreciate it. And we hope you have a great rest of your day.
Well, thank you very much. I really appreciate that very much. And I thank you for asking me to talk to you, to both of you, and to whoever else is going to see this about my personal situation, and particularly about my students, because I'm really proud of them.
Well, we'll be thinking about you and your family, and let us know, if there's anything that we might be able to help you with.
Excellent. Thank you very much.
Thanks. Take care.
Okay, Andrew. Bye, Karla.
Bye, Bede.